What do you see is the biggest issue with American health insurance that most people that are covered don't understand about the issue with health insurance in America?
Well, the issue with healthcare and healthcare insurance in America is that now, unfortunately, you've had the healthcare insurance companies act as the provider, act as the pharmacy, and act as the insurance company,
Mm.
which is never good for the consumer or the provider. So you're having so much consolidation in one company that they need to figure out how can they make money on every angle. And it's never again for the better of the consumer. And these insurance carriers have notoriously kept a closed network. So they're not actively growing and getting more providers, getting more hospitals, getting more surgery centers. They're saying, these is who you go to. We don't care about quality as much, but these people give us the biggest discount. And so if you go to them, great. If you don't, hey, it's going to be another deductible that you can't reach ever. So only about 10% of most insured people in the country reach their deductible.
So, okay, I have a PPO and it says 7,200 a year deductible.
Mm-hmm.
I go in for something that costs $3,000 and say,
Mm-hmm.
out of pocket,
Mm-hmm.
that's not covered in my insurance.
Yeah,
So they're billing me for my monthly allotment
of course.
and the $3,000,
Yep.
and they say until you reach 7,200, you're gonna have to pay out of pocket.
Of course. Good luck. So now
Hmm.
most people delay care. They will finally reach that deductible. But then there's ways that, of course, the insurance carrier is going to deny a certain service or have you, and of course, the provider at times can even delay, hey, we can't see you for another 3 months, and you're like, please, I'm this close to hitting my deductible. Please see me. But, doctors are overworked. And at times now, because of some of the methodologies and the new uh, discount companies that we compete against, they're making it very hard for a provider to feel like they're even going to get paid. So there's now even issues with getting access. So there's a lot of companies that, again, you present your card and you're like, you're in my directory, and like, no, we're not anymore. We opted out of that, or we don't want to take this card because we don't know what we're even going to get paid. So there's a lot of scare from the provider side that why am I going to deliver all this care, treat a member, and then eventually it's going to be denied, or I'm now becoming a collection agency and just balance billing you all day.
Wow. So what's your thesis to solve the healthcare insurance crisis right now through Unity Preferred?
So what we're doing is we're contracting with really innovative brokers and health plans that do not want to rely on what's called the term BUCA networks. So that's Blue Cross, United, Cigna, Aetna networks. And in doing so, we're able to take an actual role as that primary network where we can provide the directory. Members can know where to access care, ranging from every specialty they need in their area or on a national level. And then what also is happening is the brokers are creating incentives for the members so that they're not paying into their deductible or their coinsurance level is being covered by the plan. So we're contracting with providers at very favorable discounted rates that still keep the provider profitable. And in doing so, the member now knows, wow, if I go to this provider, I don't even pay a deductible. I don't pay a coinsurance. I'm being now incentivized to utilize my benefits if it is the appropriate provider that Unity is contracting with.
Wow. So the patient gets better care.
Mm-hmm.
The doctors and the clinics and the hospitals get the proper reimbursement.
They do. So in this scenario, we're contracting at a Medicare level, even though our members are 20 years old, 30 years old, 40, 50, whatever the age may be. But what's happening is that we're using that baseline. And in doing this for 20 plus years, in the early 2000s, we were never applying a Medicare methodology. We were only doing a discount off whatever the doctor billed. Now, doctors back then were billing a little bit more fairly. And I'm not here to say it's one side or the other, but yes, providers have increased their bills over the years. And that's, again, with a lot of different factors that come into play. But we cannot apply a contract that was established in 2010 that says it's a 30% discount off of bill charges, because who knows how high that charge master has increased. So the same procedure that was $500 might be $2,000 now. What does that 30% discount really bring? And so that's why we have now contracted at a Medicare level so that it caps off, regardless of however much the provider bills, we are guaranteeing that they are only paid at that allowed amount. So they can bill $10,000. Great. You are still at 120% of Medicare that grants you $800. So that $9,200 discount is where we show the value and the savings to that actual health plan.
Now, who gets the long end of the stick here and the short end of the stick of all these deals you're making?
Well, that's where we have, and this is kind of when I was on the sideline, you could say, and also on the billing company, was that you had older networks that were on that model I mentioned with a 30 or 40% discount off bill charges. Then you had what's called reference-based pricing emerge over the last 10, 15 years, where they're using technology and historical claims data and applying an algorithm that the provider never consented to. So they're seeing a bill and they're saying, we don't care, regardless, we're giving you $150 of Medicare. And the provider's like, what? Like, I didn't agree to this. Like, what do you mean? And so you had that middle ground of older networks with discounts that weren't favorable anymore because it was a discount off build. And then you had the RBPs, which, again, some of them are my friends, so I'm not here to bash them, but come in and just completely bully the market and just say, hey, I don't care if you're board certified. I don't care if you're in a rural area. I don't care what you are. You're taking this rate. And if you don't, whatever, go ahead and bill the member. And so they've been charging a ridiculous premium to the health plans and to the brokers and whoever it is at their businesses, pocketing that revenue, applying an algorithm, and not really caring about the member experience, the balance billing, the noise, or the provider now acting like they're a collection agency. So that's why I felt it was perfect timing, because RBP, as much as it's been successful, there needed to be another solution that actually can bring legitimate, signed off, secure discounts at a Medicare level where a provider's consented to that rate. Because we don't want our members being balance billed. We don't want any noise. We don't want any appeals. We have no issues at all when it comes to appeals because it's our paper. The provider signed off on this. And because we've only been in business for less than 3 years, this isn't some 2010 contract. They're like, well, who the hell signed this?
Where does a transparency come in for the patient, the provider, and the insurance company through you? Is that all transparent up front before they get services rendered?
It is, because we know the threshold we have to be at for a Medicare level. So yes, there is some providers, let's say if you're in a rural area or if you're board certified or whatever the situation may be, or if you're the only provider in this one area, we might have to be at a higher reimbursement rate on Medicare. But because we contract within those parameters and we don't really go outside of those parameters, the provider's still staying profitable, getting more than what they would from probably a United or Cigna or Aetna plan. The member's seeing significant savings because it's not one of our older competitors that just has a 10% off whatever the hell is billed. And then also the plan is seeing, because now they can create those incentives where they know we're seeing real valuable savings, and these are high quality providers. So we only get paid from the health plans, but we have to have happy, profitable medical providers, or we're not going to have a network that's going to be sustainable, or these people are going to be eventually gobbled up by large insurance carriers that now just control the whole market.
Do these healthcare providers like you guys, or do they not like you?
They do like us.
They like you.
Well,
oh, wow.
Well, remember, because we're not doing reference-based pricing where we're just coming in and saying, this is what you get, take it or leave it. We don't even need a contract. We're going out of our way, initiating the conversation, explaining the difference of what we do, identifying the members we can steer their way, and then from there, providing a fair and honest reimbursement rate that keeps them still profitable. So the difference, I guess, where, again, I've been doing this forever. I could easily, without getting a contract, say, they'll probably accept this. They'll probably accept that. But we're doing the work to secure this contract so that it lasts forever. And that, in a good way, some of our competitors have pissed off the industry too much that now they're realizing, oh, gosh, we probably need to do this now the right way. We probably need to go get real contracts. And I'm like, well, good luck. You've already basically pissed off everybody. I mean, and that's where we educate providers. Look, we're here to save you from reference-based pricing.
Yeah.
And again, there's some good RBP vendors, there's some bad ones, but ultimately now they're all trying to change or promote, hey, we're not just RBP. We're doing real contracts. Really, they're probably calling us and saying, can we lease your network?
Wow.